I don't want to downplay the impact of this so-called fifth wave, of course. We've had triple digits, more than 100 cases over the last 4 days. There is a health threat here. But at what point, if I can play the devil's advocate right off the bat, at what point can you say that perhaps zero COVID or dynamic zero COVID, as the policies adapt, is a bit futile, as it proves with this latest wave that it is extremely difficult to keep the virus and its variants out of Hong Kong, despite zero COVID policies?
Yeah, thank you. Thank you for your question. On the one hand, as you have already alluded to, we are working very hard to fight the Omicron virus as it has been spreading very fast, as it's been known in the experience globally. So on the one hand, we are still adopting the dynamic zero strategy using our measures, and the measures including, obviously, is the contact tracing and strengthening and expanding our compulsory testing and also quarantining people, either home quarantine or quarantine at the quarantine center or the hotels, as well as putting people in the hospital for isolation if they are confirmed cases. On the one hand, obviously, this is going on, and we are, fighting fearlessly, and time is of the essence. But on the other hand, I think we need to, before we can say anything about, relaxing, we are also trying our very best to improve our vaccination rate, because we think this is also very important. Hong Kong's overall vaccination rate is about 78%. But then if you look at the different age groups, the elders, for example, those who are above 80 years of age, is only about 30%. So I think we need to really ramp up our vaccination rate, especially among the elderly, so that everybody is protected in the community before we can sort of further strategize these strategies. On the other hand, we understand with this very stringent measure of, for example, border control, and because we have to prevent importation of cases, as well as preventing these viruses from going into the community, there are a lot of troubles being affected. We are on the one hand assessing the risk of different countries, and on the other hand, we are also looking at our data scientifically to see the incubation period of Omicron, to see whether there is a room for further adjustments of our measures. So we are sort of working on different.
Let me just. Let me, I apologize for interrupting you, but I think we're getting to the crux of the issue that is affecting sentiment here in Hong Kong, obviously within the banking community, the international community, locals as well. And that is, what is the roadmap, and why hasn't the government properly articulated that roadmap as far as benchmarks? If we hit X percentage of total vaccinations, 90%, we can relax some of these restrictions, such as the flight bans, as well as the 21-day quarantines and the like. It seems like it's more of an ad hoc, week-by-week approach that is leading to lots of frustration, and lots of companies as well. American Chamber of Commerce is saying, there's no light at the end of the tunnel. Bank of America is saying because of the COVID rules, they're moving staff to Singapore. It's a knockdown consequence of unintended consequences. We just need to get a clearer view of the strategy going forward for an exit strategy, or is this in perpetuity?
I understand, there are frustrations because of our very stringent measures, but then our strategy is very clear. We need to protect, our people, the safety and also health of our people in the community. And this is also the expectation of our people as well. So at this stage, we are still adopting the dynamic zero strategy. On the other hand, I would disagree with that. It is an ad hoc sort of a week by week. Obviously, not week by week. Every day we are assessing, the risk and, coming up with measures. But if you look at the strategy, we are still adopting the zero, dynamic zero strategy, so that all our measures are really, going towards the aim of zero. So it must be stringent. But because of the Omicron taking over, Delta globally, so we are also looking on the other hand, on the data, for example, the Omicron incubation period in people, so that if there are room for adjustments of the quarantine period, we will do so.
All right. Is home quarantine a feasible possibility? If and when, and do you see this possibility, the infrastructure, whether it's at the Penny's Bay facility or in hospitals, and the lengthy quarantines that have caused this and this outbreak as it expands, can home quarantine or other areas of change possible?
Yes, I think before, actually last December, when the rest of the world are facing the Omicron very severe situation, we are already preparing for the coming of the fifth wave. So one of the options, obviously, if we have used up all our Penny's Bay capacity, which is not unlimited, yes, home quarantine would be an option. But of course, we would have to assess the risk as to, who will be going to Penny's Bay and who will be having home quarantine. So home quarantine is an option, but there are also other challenges that would bring about, home quarantine. If we are thinking of a home quarantine where people cannot come out, so there is another issue of supplies and how people can maintain, their daily living within the home if they do not have supplies. That would be a multi-department collaboration and cooperation in order to make this work.
We just showed a statistic about the number of people who have gotten the vaccinations here in Hong Kong, and overwhelmingly, you see more than 77% of working age people from 20 to 59 or thereabouts have gotten their vaccinations. But we all know here in Hong Kong that less than 20 or thereabouts 20% of 80-plus-year-olds, the elderly, have gotten it. I'm going to ask the insensitive question here. Why do the rest of Hong Kong have to pay for the elderly who refuse to get it? And why have your policies failed to convince them to do it?
Well, I think we have been, doing trying our very best, to facilitate, to find out, why are the elderly not taking the vaccination, and trying to facilitate the vaccination, especially for the elderly, and doing more, especially in the elderly home, and trying to educate, the public, for example, the relatives of the elders, so that they would not, disallow, their parents, to take vaccination, especially those in the elderly homes. So we have been, doing a lot all along. The graph that you have shown, in fact, is not the latest. So the latest is that over 80 age group, there is about 30%. So, it has worked, but then it is not as fast as we would like to be, but we are having further measures. The Social Welfare Department, who is responsible for elderly home, is working tirelessly on different measures, and we are having another campaign going to the elderly home to do further vaccination in the coming while.
Are you in favor of mandating vaccines? We've gotten to the point, we're 2 years in here, and there is no way out, it seems, under zero COVID. Why not mandate it?
Well, we still have not gone to sort of mandating people in taking vaccine, but we are having different strategies. For example, the vaccine pass. So we will be, we have already started in some of the restaurants that people can't go into some of the restaurants if they are not vaccinated. Our bars, our karaokes are already adopting, this measure. So we will be extending and expanding, this vaccine bubble or vaccine vaccine pass measure into more premises. For example, hotels, for example, more catering businesses, schools, government buildings, and so on and so forth. So we will be pushing this out after Chinese New Year.
There's been a lot of talk about if Hong Kong reaches 90% vaccination. It's 70 plus right now. Is that a number you look at as a benchmark that we can then start making some relaxations at the border? I'm not talking about China because that's dependent on how China gets its virus situation under control. But I'm talking about international travel and also some of these social restrictions. Is 90% a number, or do you not trust the vaccines well enough?
Well, of course, we trust the vaccines. We ask people, to take vaccine. But scientifically, we understand that vaccines are good in protecting people from severe illness and also protecting people from the risk of dying. But at the same time, it may not totally work for preventing people from being infected. But after people being infected, they would have less severe symptoms and so on. So on the one hand, we are pushing our vaccination rate. Obviously, if it go up to 90% or over 90%, that means 90% of our people are protected, at least, even if they got Omicron. They would have less symptoms and so on. So I think, obviously, we want the vaccination rate to get as high as possible. But as I've said earlier, if we are looking at our border control measures, it would have to depend on the global pandemic. How the rest of the world is doing in terms of the epidemic situation, number one. And number two, we are going to follow the science of Omicron and also the incubation period in order to adjust, our quarantine days and so on. Taking into consideration, our basic strategy is still dynamic zero.
Well, the science of the virus also tells us that the Chinese homegrown traditional vaccines, Sinovac and Sinopharm, are not as effective against Omicron and the variants as the mRNA varieties, which, let's face it, China has not green-lighted the use of Pfizer, BioNTech, and other mRNA. They're developing their own mRNA, which a latest study indicates it is not necessarily as effective yet and not nearly ready for mass adoption. Is that going to be the key, China's introduction of its own mRNA? As the health secretary and a doctor yourself, what does the science tell you about that?
Well, I think in Hong Kong, we have two vaccines available for our people. One is the Sinovac, that is the inactivated virus platform, and the other one is mRNA, the BioNTech. So I think about 60% of people are taking, BioNTech, and 40% of people are taking Sinovac. Our experts have told us that both vaccines are effective in protecting oneself from. If you are being infected, then you are being protected from less severe symptoms, as well as the risk of dying would be lower, and going to ICU would be lower. And I think this is the basics.
Do you see China? What are you, in your dialogue with China? We're going to talk about the border here, both international flights, in just a minute, because we know there's been a ban there. But what's the latest on the border? Obviously, we're in the middle of a wave. We're in the middle of the Olympics about to start in a couple of weeks. Are you getting any indication that China, on its side of the border, will be able to open the border with Hong Kong soon?
Well, we have been trying to discuss, through our communication channels with China about resuming quarantine-free travel, Hong Kong and China. So the work is ongoing. Of course, we have this recent outbreak. So, this is really not the time, to start this quarantine-free travel with China. But we have in November, a team of China experts, mainland experts from the National Health Commission came to Hong Kong, and they think, the Hong Kong measures are effective, and we actually have attained the conditions for quarantine travel. Right. So it's the preparation work that is ongoing.
But right now it's on hold, obviously, given this wave right now, and perhaps it is dictated what's going to happen across the border. Let's talk about international travel. It is a key issue for much of our audience that is watching this right now, whether it's international business, also people here who feel kind of stuck in Hong Kong. Are those flight bans going to be, given the current situation, be extended again? I believe a review is going to be tomorrow. Will it be another 2 weeks? And again, every week or every 2 weeks, it's a constant review of this.
Yes, we are reviewing the overall situation, and as I've said, it very much depends on the epidemic situation of the countries in terms of the flight bans. But at the same time, we are also reviewing our quarantine period, and because now Omicron actually overtake Delta, even globally. So we are doing a review every day, and once we have further adjustments, we will announce.
Will there be a review, though, tomorrow, I believe? Given the current situation today, does that warrant, from a health perspective, the further delay, postponement, or cancellation of these international flights from the high-risk countries like the United States, like the UK? I mean, businesses really do need to plan, Secretary Chan. I'm sure you recognize that.
Yes, if one look at the global situation of, for example, the countries that you have just mentioned, it seems that it is still on the rise. So I think our assessment would be based on those latest epidemic situations by our Center for Health Protection of the Department of Health. And once we have made a decision, we will make announcements.
If I can go back to the China border, under what conditions have Beijing officials given you the latest information? What conditions, when this wave subsides, what conditions must you meet?
Well, I think, for example, during our discussion in November and December, Hong Kong has attained, dynamic, zero infection in the community. So at that point, we have met, the criteria and the overall situation that for quarantine-free travel. But obviously, we are working on for example, suspension mechanism. So at what point would stop, for example, if we have an outbreak, and also a lot of border, sort of border preparation in opening or reopening, the border with China. So those work are actually continue. But as you have already alluded to earlier, now is on hold because of, the outbreak, and we are, putting our focus, onto trying to curb the epidemic at this point in time and racing with the virus.
And now, Secretary Chan, I want to bring up this draft report that came from the European Chamber of Commerce predicting, and it's still a long ways out, but predicting that this lockdown, because of the zero COVID or dynamic zero policies of Hong Kong, this could isolate Hong Kong through 2024. That is another 2 years, so 4 years of isolation. I know you have to take the health concerns, with the business concerns, because a lot of people are saying this is killing Hong Kong. It's definitely hurting. I'm questioning whether Cathay Pacific, for one, can even survive. Would you agree with this assessment from the European Chamber of Commerce that this, because of your policies, could isolate Hong Kong through 2024?
Well, if you ask me, obviously, public health considerations is number one. But I'm also optimistic because in the past 2 years, the Hong Kong government have already built up our capacity in terms of fighting with the virus, and also the different measures that we are taking. On the one hand, from the public health perspective, the most important thing is to protect our people from health and also safety. But on the other hand, the other ministers, for example, business ministers, commerce ministers, and the overall government would take into consideration the overall situation and also other considerations in balancing the entire situation, including not only public health, but also economic situation.
We talked about the potential hitting of the ceiling, if you will, on the facilities. We know Penny's Bay, the camp where the quarantined individuals have to go, is reaching capacity. Can you tell us how much more room you actually have? I know you can add hotel rooms, but again, there's been lots of criticisms from people flying in and having to stay there, short-staffed, you can't get people on the phone, there's some sanitary issues. We're seeing the same kind of complaints at Kwai Chung Estates, which have been locked down in this dynamic zero, phase of, prevention. Where are your shortfalls, and when are you going to hit that maximum?
I think for this Omicron wave, because time is of the essence. So everything really happened very fast. So therefore, we have been reviewing, the manpower, adding more manpower, into Penny's Bay and into sort of containing these lockdowns within the Kwai Chung estate, trying to improve the situation, day by day. On the one hand, there are, bottlenecks because we have, lots of different departments, trying to help with all these different measures. On the other hand, we are also ramping with our testing capacities. So we are sort of moving towards our dynamic zero infection. But at the same time, our capacities are also something that we are trying to ramp up at different places because it's been running so fast.
I know we need to wrap this up, but I just want to leave it here where I ask you, are you optimistic or pessimistic that we can return to some sort of normalcy within a year?
I am optimistic, if you ask me.
What gives you that optimism?
Well, I think we are in control, of the virus. On the one hand, we see, Omicron, infecting people and moving, spreading very fast. But on the other hand, we are very clear in terms of our strategy, and we know how to do it. So therefore, it's the capacity and also, some sort of frontline operational issues that we have to, iron out and also, bottleneck. On the other hand, there are many successful experience. There are many, good commendation from Penny's Bay. So I think it is important for us to sort of balance and not only look at negative comments. We receive lots of positive comments as well. So, I'm optimistic and we are in control.
Well, are you optimistic about reducing the length of hotel quarantine from 21 days? That's what everyone really wants to know here in the business community. Can it happen within the next few months?
Well, I am optimistic as well because we have already shortened the quarantine period in Penny's Bay from 21 days to 14 days when looking at the scientific data, from the incubation period of Omicron. So we are sort of assessing, making risk assessments every day.